All right, so now that we've talked about the pathophysiology behind hemorrhagic and ischemic strokes, let's look at what we might see in those patients and how we're going to assess them. You've probably seen this mnemonic or heard this mnemonic before somewhere, and the key phrase to remember is when you see signs of stroke, you have to act fast. F A S T. F A S T. This tells us the signs of stroke. F stands for facial drooping. So we're going to see one side of the face much weaker or not able to move like the other side. A is for arm weakness. They typically have one side of the body much weaker than the other, if not paralyzed completely. So we test this by having them hold both arms out straight in front of them and trying to hold them up for 10 seconds. If you have this weakness, you'll see one arm begin to drift back down towards the bed. Drift means it just starts to fall slowly. Now, S stands for slurred speech. They may struggle to form words well, or they may even see that they have complete aphasia. And we're going to look at that in just a minute. Okay, different types of aphasia. T stands for time. Remember, we're acting fast. Okay, you must do something fast. So time is tissue. That's something you're going to hear people say. Time is tissue. What that means is the faster we're able to act, the more brain tissue we're going to be able to save. So you need to get help, notify the right people as fast as possible. As with any neurological issue, the first thing we're going to see is altered level of consciousness. LOC is level of consciousness. This could be anything from confusion all the way to coma. We're going to see the weakness and deficits present contralateral to the side of the stroke. What does that mean? Well, that really just means that, for example, a right MCA stroke is going to show symptoms like left arm weakness. So right is going to present on the left side of the body, left is going to present on the right side of the body. That's all that contralateral means. Now, with stroke patients, we oftentimes see aphasia as well, which really just means a lack or trouble with speaking. Now, this can either be expressive, receptive, or global. Let's talk about each one of these individually. With expressive aphasia patients, they can understand everything you're saying, but they cannot get the right words out. So they can understand, but they just can't get the right words out. So they're going to mumble. They may cycle on a few words. Like one time I had a patient who kept repeating, and that's just all he could say, or they could be talking complete nonsense. Sometimes you'll have family members come in and they see their family member with expressive aphasia, and they might say something like, "Mama's talking out of her head," because they just wasn't making sense. So they just have a hard time making any sense. And it can be really scary to the patient and to the family because they think that maybe this person doesn't understand what's going on. But in reality, they understand very well. They're just unable to get the words out. So receptive aphasia is a little bit different. What happens here is they can communicate perfectly, but they absolutely cannot understand anything they're reading or that you're saying to them. Now imagine how frustrating that could be for the patients, because even when they try to write a word, they look at it and think they wrote it wrong. So they'll keep saying, "You aren't making any sense. You aren't making any sense." So that would be so incredibly frustrating, I think. And then the last one is global aphasia. Now, global aphasia means they struggle with comprehension and communication. So they can't comprehend and they can't communicate, and they may not have speech at all. So this is very frustrating to the family, to the patient, and in the nursing care lesson, we'll talk about how we can help these patients. So I just want you to keep in mind that with aphasia, it doesn't necessarily mean the patient doesn't know what you're saying to them. Okay, like with expressive and receptive, they know what you're saying, or like with expressive, they know what you're saying, they understand very well, but they can't get the right words back to you, okay? And just try to understand how frustrating that's going to be for the patient and try to work with them. We're going to talk a little bit about that later. Stroke patients may also have something called ataxia, which is when they can't coordinate movement, and they might also have apraxia, which is when they can't perform simple tasks like brushing their hair or writing their name. So ataxia, they can't do any movement. Apraxia, they can't do simple tasks. They just can't coordinate the steps they know in their mind that they need to be doing with their hands to get that right movement happening. Now, patients can also have something called heminopia. Heminopia. So let's break that word down. Hemi means one side, an means without, and apia means vision. So what these patients really have is they have no vision on one side of their visual field. They'll completely miss anything happening on that side of their visual field. Patients may also have dysphagia, which means they have difficulty swallowing or weakness of the muscles required to swallow. So we have to do swallow evals before we do anything. And these patients have to pass these swallow evals. We make them swallow a few mils of water and see that they don't have any coughing, because if they can't even get down a couple mils of water and then we give them a big old drink or we give them some food, imagine how that food is going to get into their lungs and how dangerous that could be. Another thing we're going to do is something called the NIH stroke scale. Now, this is something you have to be trained for. And if you work in a stroke floor or in like an ICU, you would get your stroke certification. Now, what it does, it tests things like drift, speech, and vision and motor movements, and scores the patient on a score from 1 to 42. The higher the number, the more severe the stroke is. So this image here is one of the images that we actually use when we do our NIH stroke test. What we do with this image, and it's really helpful, is it helps us to test their ability to see, their ability to speak, and their ability to form those words. Now, what you're going to see with these patients sometimes is they can't see both sides of this image. So you hold this image right up in front of them, and they might only be able to see the mom doing dishes, or they might only be able to see the kids in the cookie jar, or you might be able to see that they know what's happening there, but they can't get the right words. They'll be like, boy on a ladder, and they just can't get that right word about cookie jar. Or you can say, what's happening here? And they'll say, chicken, chicken, chicken. They just can't get those right words out. So this is really important for us to be able to determine their ability to speak and their ability to see, and what their vision field is like. So this is one of the images we use in that NIH stroke scale. Now, we talked about this a little bit in the ischemic stroke lesson, but remember, the presentation of each patient is going to vary based on where the stroke is located. So what I've done here is I've shown you 3 places where a stroke can occur. It can occur in the MCA, a basilar stroke, or a brainstem stroke. And you're going to have different symptoms, different presentation for your patient based on that. And it's really important to know this a little bit. And because what will happen is you'll call your physician, say, hey, we have a stroke coming in, and they're going to ask what the symptoms are. And before they even look at the CT, they might be able to tell exactly where that stroke occurred. It's also helpful for you because if you know what you should be expecting with like an MCA stroke, classic fast symptoms, contralateral, and then you start seeing like respiratory failure, we know something else is going on here. So we need to assess the patient, look for any signs of deterioration or anything like that. But with our MCA stroke, our middle cerebral artery strokes, you're going to see these really classic fast symptoms, FAST that we talked about earlier. And you're going to have that contralateral effect where the deficits are on the opposite side of the infarct. And then with your basilar strokes, this is going to affect level of consciousness. Okay, it's going to also affect the eyes, the vision field, and it can also create abnormal pupil responses. So you're going to see those pupillary changes, and that's why we've talked before about the PERLA. Pupils equal, round, reactive to light, and accommodate. That's why we do those tests. And with your stroke patients, it's really important that you're doing those tests. A lot of neuro ICUs and stuff are going to have Q2 hour vital sign checks. That's going to also include checking pupils. Now, with the brainstem strokes, these are very devastating. As you move down, you get to your more base functions, your brainstem all the way down here. If we affect that with a stroke, we're losing a lot of our base functions. Like we're going to lose BP regulation, we could have respiratory failure, and we could have dysphagia. Now, these are just a few examples. You can find more examples in the cheat sheet attached to this lesson, but we want you to see how this might look different for each patient. So always remember to act fast. Facial droop, arm weakness, slurred speech, time is tissue. Remember to act fast. Call 911, call a rapid response, whatever's most appropriate course of action. Now remember, strokes aren't something that we know is going to come. All right, we have patients who are at risk for stroke, but strokes happen. A lot of times you'll see patients come in and they're like, hey, mom was just having dinner with us and now she just had this stroke. All right, we were just out at a movie and now she had a stroke. Last Sunday, everything was fine and now he had a stroke. So you must know these signs and symptoms. All right, and you must, as a nurse, as a medical professional, you got to know these, okay, and you got to be prepared for these. Now remember that the symptoms of the stroke will present on the side opposite where the stroke is in the brain and that symptoms and presentation will vary by location of the stroke. The most common things you see are these fast symptoms and altered level of consciousness. Okay. Now review the neuro assessment lessons and look over that, look over the care plans, look over the more information about level of consciousness and pupil assessments. We have all that information in there, and I want you guys to go do all those things. This is so important. Keep working through this module, keep learning everything you need to about these stroke patients because it's a very common condition. All right. Now, you guys, as always, I want you to go out and be your best self today. Happy nursing.